Question 1. A patient with septic shock has a blood pressure of 78/42 millimeter of mercury despite receiving 2 liters of 4 fluids. Which medication should the nurse anticipate administering next? A. Furosemide. B. Norepinephrine. C. Acetaminophen. D. Heparin. Correct answer, B. Norepinephrine. Rationale: norepinephrine is the first-line vasopressor used when fluid resuscitation does not adequately improve blood pressure in septic shock. It helps increase vascular tone and maintain organ perfusion. Strategy: when you see septic shock and persistent hypotension after fluids, think vasopressors. Remember, fluids first, vasopressors second. Question 2. A critically ill patient suddenly becomes restless and confused. What is the nurse's priority action? A. Call the family. B. Administer a sedative. C. Assess oxygen saturation. D. Document findings. Correct answer, C. Assess oxygen saturation. Rationale: restlessness and confusion are often early signs of hypoxia. Assessing oxygenation is essential before implementing other interventions. Strategy: on Nclex, unexpected confusion often signals inadequate oxygen delivery. Always assess airway and breathing first. Question 3. A patient diagnosed with a pulmonary embolism reports sudden chest pain and severe shortness of breath. Which finding would the nurse expect? A. Bradycardia. B. Hypotension. C. Hypertension. D. Warm flushed skin. Correct answer, B. Hypotension. Rationale: a pulmonary embolism can obstruct blood flow through the lungs, reducing cardiac output and causing hypotension. Strategy: think of a pulmonary embolism as a blockage that strains the right side of the heart. Signs of shock are common in severe cases. Question 4. Which assessment finding indicates improvement in a patient being treated for heart failure? A. Increased crackles. B. Weight gain. C. Decreased edema. D. Distended neck veins. Correct answer, C. Decreased edema. Rationale: reduced peripheral edema indicates that excess fluid is being removed and cardiac function is improving. Strategy: for heart failure questions, monitor fluid status. Less edema and weight loss generally indicate improvement. Question 5. A patient with diabetic ketoacidosis, DKA, is receiving 4 insulin therapy. Which laboratory value requires the closest monitoring? A. Calcium. B. Potassium. C. Magnesium. D. Chloride. Correct answer, B. Potassium. Rationale: insulin causes potassium to move into cells, increasing the risk of hypokalemia during treatment. Strategy: whenever insulin is administered in DKA, think potassium. Nclex frequently tests this relationship. Question 6. A patient develops ventricular tachycardia and has no palpable pulse. What should the nurse do first? A. Administer oxygen. B. Start CPR. C. Obtain blood pressure. D. Insert a urinary catheter. Correct answer, B. Start CPR. Rationale: pulseless ventricular tachycardia is a cardiac arrest rhythm that requires immediate CPR and defibrillation. Strategy: if the rhythm is pulseless VT or ventricular fibrillation, start CPR immediately and prepare for defibrillation. Question 7. Which assessment finding requires immediate intervention in a patient with increased intracranial pressure? A. Headache. B. Nausea. C. Unequal pupils. D. Fatigue. Correct answer, C. Unequal pupils. Rationale: unequal pupils may indicate brain herniation, a life-threatening neurological emergency. Strategy: changes in pupil size or reactivity are red flags. Prioritize neurological deterioration over less severe symptoms. Question 8. A patient receiving a heparin infusion develops bleeding gums. Which laboratory result should the nurse review first? A. INR. B. Point. C. APTT. D. Hemoglobin A1C. Correct answer, C. APTT. Rationale: the APTT is used to monitor heparin therapy and assess the risk of excessive anticoagulation. Strategy: match the drug to the laboratory test. Heparin equals APTT, warfarin equals INR. Question 9. A patient with a tension pneumothorax is most likely to exhibit which finding? A. Bilateral breath sounds. B. Tracheal deviation. C. Bradycardia. D. Hypertension. Correct answer, B. Tracheal deviation. Rationale: air trapped under pressure shifts mediastinal structures, causing tracheal deviation away from the affected side. Strategy: tension pneumothorax is an emergency. Remember the classic clues: absent breath sounds, respiratory distress, and tracheal deviation. Question 10. A patient with acute respiratory distress syndrome, ARDS, has worsening oxygen saturation despite oxygen therapy. Which intervention is most likely to improve oxygenation? A. Restrict fluids completely. B. Place the patient in the prone position. C. Lower the head of the bed. D. Encourage ambulation. Correct answer, B. Place the patient in the prone position. Rationale: prone positioning improves ventilation perfusion matching and enhances oxygen exchange in patients with ARDS. Strategy: when ARDS appears on Nclex, think severe hypoxemia and prone positioning. It is a commonly tested intervention. Question 11. A patient with severe burns has a urine output of 15 milliliters per hour. What is the nurse's priority action? A. Restrict fluids. B. Increase 4 fluids as prescribed. C. Administer diuretics. D. Encourage oral fluids. Correct answer, B. Increase 4 fluids as prescribed. Rationale: low urine output may indicate inadequate tissue perfusion and fluid replacement following a major burn injury. Strategy: in burn patients, urine output is one of the best indicators of adequate fluid resuscitation. Question 12. A patient is admitted with cardiogenic shock. Which assessment finding is expected? A. Warm, dry skin. B. Bounding pulses. C. Pulmonary crackles. D. Increased urine output. Correct answer, C. Pulmonary crackles. Rationale: cardiogenic shock causes left ventricular failure, leading to fluid backup into the lungs. Strategy: think pump failure. Signs include crackles, hypotension, and poor tissue perfusion. Question 13. A patient with a chest tube suddenly has no drainage. What should the nurse do first? A. Assess the tubing for kinks. B. Remove the chest tube. C. Clamp the tube. D. Increase suction. Correct answer, A. Assess the tubing for kinks. Rationale: obstruction of the tubing can prevent proper drainage and impair lung re-expansion. Strategy: always assess equipment before taking corrective actions. Question 14. Which finding suggests fluid volume overload? A. Flat neck veins. B. Weight loss. C. Crackles in lungs. D. Dry mucous membranes. Correct answer, C. Crackles in lungs. Rationale: excess fluid often accumulates in the lungs, causing crackles during auscultation. Strategy: Nclex frequently links crackles with fluid overload and heart failure. Question 15. A patient receiving mechanical ventilation suddenly develops high-pressure alarms. What should the nurse assess first? A. Presence of secretions in the airway. B. Urine output. C. Temperature. D. Blood glucose. Correct answer, A. Presence of secretions in the airway. Rationale: secretions, coughing, or airway obstruction commonly trigger high-pressure alarms. Strategy: ventilator alarms require immediate airway assessment before other interventions. Question 16. A patient with acute myocardial infarction develops cool clammy skin and hypotension. What complication should the nurse suspect? A. Cardiogenic shock. B. Hyperglycemia. C. Pericarditis. D. Pneumonia. Correct answer, A. Cardiogenic shock. Rationale: extensive heart muscle damage can impair pumping ability and lead to shock. Strategy: after an MI, watch for signs of poor perfusion and low cardiac output. Question 17. A patient with severe hyperkalemia is most at risk for A. Vision changes. B. Cardiac dysrhythmias. C. Hearing loss. D. Hypertension. Correct answer, B. Cardiac dysrhythmias. Rationale: elevated potassium levels can interfere with cardiac electrical conduction. Strategy: potassium problems often equal heart rhythm problems on Nclex. Question 18. Which assessment finding is most concerning in a patient with sepsis? A. Temperature of 38.2 degrees Celsius 100.8 degrees Fahrenheit. B. Heart rate of 110 per minute. C. Urine output of 20 milliliters per hour. D. Respiratory rate of 24 per minute. Correct answer: C. Urine output of 20 milliliters per hour. Rationale: reduced urine output indicates poor organ perfusion and possible progression to septic shock. Strategy: low urine output is often an early sign of organ dysfunction. Question 19. A patient experiences sudden shortness of breath after central line insertion. What complication should the nurse suspect? A. Pneumothorax. B. Stroke. C. Pulmonary edema. D. Kidney failure. Correct answer, A. Pneumothorax. Rationale: accidental lung puncture during line insertion can cause air to enter the pleural space. Strategy: central line plus sudden respiratory distress equals pneumothorax until proven otherwise. Question 20. A patient with increased intracranial pressure should be positioned. A. Flat in bed. B. Trendelenburg position. C. Head elevated 30 degrees. D. Prone position. Correct answer, C. Head elevated 30 degrees. Rationale: elevating the head promotes venous drainage from the brain and helps reduce ICP. Strategy: for ICP questions, remember HOB at 30 degrees unless contraindicated. Question 21. A patient receiving blood transfusion develops chills and fever. What should the nurse do first? A. Slow the infusion. B. Stop the transfusion. C. Administer acetaminophen. D. Continue monitoring. Correct answer, B. Stop the transfusion. Rationale: fever and chills may indicate a transfusion reaction requiring immediate discontinuation. Strategy: any suspected transfusion reaction equals stop the blood first. Question 22. Which laboratory value indicates the greatest risk for bleeding? A. Platelets 40,000/mm superscript 3. B. Sodium 135 milliequivalent/L. C. Potassium 4.2 milliequivalent/L. D. Glucose 100 mg per deciliter. Correct answer, A. Platelets 40,000/mm superscript 3. Rationale: severe thrombocytopenia significantly increases bleeding risk. Strategy: platelets below normal should immediately make you think bleeding precautions. Question 23. A patient with ARDS becomes increasingly hypoxic. Which physician order should the nurse implement first? A. Increase oxygen concentration. B. Obtain weight. C. Collect urine specimen. D. Restrict visitors. Correct answer, A. Increase oxygen concentration. Rationale: oxygenation takes priority when a patient is severely hypoxic. Strategy: airway and breathing always come before routine tasks. Question 24. A patient develops sudden unilateral weakness and slurred speech. What is the priority action? A. Check blood pressure tomorrow. B. Activate the stroke protocol. C. Encourage rest. D. Offer water. Correct answer, B. Activate the stroke protocol. Rationale: early intervention improves outcomes and may preserve brain tissue. Strategy: think fast, face, arm, speech, time. Question 25. A patient with septic shock has a serum lactate level of 6 millimoles per liter. What does this indicate? A. Improved tissue perfusion. B. Poor tissue oxygenation. C. Normal metabolism. D. Excess potassium. Correct answer, B. Poor tissue oxygenation. Rationale: elevated lactate suggests anaerobic metabolism due to inadequate tissue perfusion. Strategy: high lactate equals worsening shock until proven otherwise. Question 26. Which finding indicates that CPR is effective? A. Absence of pulses. B. End-tidal CO2 rises during compressions. C. Cyanosis increases. D. Heart rate decreases. Correct answer, B. End-tidal CO2 rises during compressions. Rationale: improved end-tidal CO2 reflects better blood circulation during CPR. Strategy: higher EtCO2 usually means better quality chest compressions. Question 27. A patient with acute kidney injury has peaked T waves on ECG. What electrolyte imbalance should the nurse suspect? A. Hypocalcemia. B. Hyperkalemia. C. Hyponatremia. D. Hypomagnesemia. Correct answer, B. Hyperkalemia. Rationale: peaked T waves are a classic ECG sign of elevated potassium levels. Strategy: memorize ECG changes associated with potassium abnormalities. Question 28. A patient with a tracheostomy suddenly becomes anxious and has difficulty breathing. What should the nurse do first? A. Assess for airway obstruction. B. Notify the provider. C. Obtain consent. D. Administer pain medication. Correct answer, A. Assess for airway obstruction. Rationale: a blocked tracheostomy can rapidly cause respiratory failure. Strategy: anxiety and breathing difficulty often signal airway problems. Question 29. A patient with severe head trauma develops a blood pressure of 180/60 mmHg and a heart rate of 48 per minute. What does this indicate? A. Recovery from injury. B. Cushing's triad. C. Dehydration. D. Hyperglycemia. Correct answer, B. Cushing's triad. Rationale: bradycardia with widened pulse pressure is a sign of increased intracranial pressure. Strategy: Cushing's triad is a neurological emergency frequently tested on Nclex. Question 30. A patient with gastrointestinal bleeding becomes pale, dizzy, and hypotensive. What is the priority nursing action? A. Assess for signs of shock. B. Provide a meal tray. C. Encourage ambulation. D. Restrict fluids. Correct answer, A. Assess for signs of shock. Rationale: significant blood loss can rapidly progress to hypovolemic shock and organ failure. Strategy: when bleeding and hypotension appear together, think shock and assess circulation immediately. Question 31. A patient with severe hypovolemia has a blood pressure of 82/40 mmHg. Which finding is expected? A. Bounding pulses. B. Warm flushed skin. C. Tachycardia. D. Bradycardia. Correct answer, C. Tachycardia. Rationale: the body compensates for low circulating volume by increasing heart rate to maintain cardiac output. Strategy: in shock states, tachycardia is usually one of the earliest signs. Question 32. A patient receiving a potassium infusion reports burning at the foresite. What should the nurse do first? A. Stop the infusion and assess the foresite. B. Increase the infusion rate. C. Apply ice directly to the site. D. Ignore the complaint. Correct answer, A. Stop the infusion and assess the foresite. Rationale: potassium is irritating to veins and may indicate infiltration or phlebitis. Strategy: always investigate complaints of burning during medication administration. Question 33. A patient with acute pulmonary edema is struggling to breathe. Which action should the nurse take first? A. Lay the patient flat. B. Position the patient upright. C. Offer food. D. Restrict oxygen. Correct answer, B. Position the patient upright. Rationale: sitting upright improves lung expansion and reduces venous return to the heart. Strategy: positioning can be a life-saving intervention for respiratory distress. Question 34. A patient with a stroke suddenly develops difficulty swallowing. What is the priority nursing action? A. Give water to test swallowing. B. Keep the patient NPO. C. Encourage eating. D. Administer sedatives. Correct answer, B. Keep the patient NPO. Rationale: dysphagia increases the risk of aspiration and airway compromise. Strategy: stroke plus swallowing difficulty equals aspiration precautions. Question 35. A patient on a ventilator has oxygen saturation of 84%. What should the nurse assess first? A. Ventilator tubing connections. B. Family concerns. C. Intake and output. D. Dietary intake. Correct answer, A. Ventilator tubing connections. Rationale: disconnected or malfunctioning equipment can quickly cause hypoxia. Strategy: always assess the patient and equipment before calling for help. Question 36. A patient develops ventricular fibrillation. What is the priority intervention? A. Defibrillation. B. Obtain laboratory values. C. Insert a Foley catheter. D. Check blood glucose. Correct answer, A. Defibrillation. Rationale: ventricular fibrillation is a fatal rhythm unless promptly treated with defibrillation. Strategy: shockable rhythms are VF and pulseless VT. Question 37. A patient with sepsis becomes confused and difficult to arouse. What does this most likely indicate? A. Improved status. B. Decreased cerebral perfusion. C. Hunger. D. Recovery phase. Correct answer, B. Decreased cerebral perfusion. Rationale: altered mental status is a sign of worsening organ dysfunction in sepsis. Strategy: changes in consciousness often signal deteriorating perfusion. Question 38. Which laboratory value requires immediate reporting? A. Potassium 6.8 milliequivalent/L. B. Sodium 138 milliequivalent/L. C. Calcium 9.2 mg per deciliter. D. Glucose 100 mg per deciliter. Correct answer, A. Potassium 6.8 milliequivalent/L. Rationale: severe hyperkalemia can cause life-threatening cardiac dysrhythmias. Strategy: potassium abnormalities are Nclex favorites because they affect the heart. Question 39. A patient with a head injury begins vomiting repeatedly. What should the nurse suspect? A. Increased intracranial pressure. B. Dehydration. C. Recovery. D. Hyperglycemia. Correct answer, A. Increased intracranial pressure. Rationale: repeated vomiting is a classic sign of rising intracranial pressure. Strategy: neurological changes after head injury require immediate attention. Question 40. A patient receiving morphine becomes difficult to awaken and has a respiratory rate of 8 per minute. Which medication should the nurse prepare? A. Protamine sulfate. B. Flumazenol. C. Naloxone. D. Atropine. Correct answer, C. Naloxone. Rationale: naloxone reverses opioid-induced respiratory depression. Strategy: morphine overdose equals naloxone on Nclex. Question 41. A patient with chest pain suddenly loses consciousness and has no pulse. What is the nurse's first action? A. Obtain an ECG. B. Begin CPR. C. Notify family. D. Draw blood samples. Correct answer, B. Begin CPR. Rationale: immediate chest compressions are essential during cardiac arrest. Strategy: no pulse means CPR first, not diagnostics. Question 42. A patient with severe burns is at greatest risk for which complication during the first 24 hours? A. Fluid volume deficit. B. Obesity. C. Hypercalcemia. D. Cataracts. Correct answer: A. Fluid volume deficit. Rationale: massive fluid shifts occur after burn injuries, leading to hypovolemia. Strategy: early burn care focuses on fluid replacement. Question 43. A patient with acute kidney injury has a urine output of 10 milliliters per hour. What should the nurse assess first? A. Fluid status. B. Hair texture. C. Appetite. D. Vision. Correct answer: A. Fluid status. Rationale: oliguria may indicate worsening kidney function or inadequate perfusion. Strategy: low urine output should always trigger an assessment of circulation and hydration. Question 44. Which finding indicates successful treatment of septic shock? A. Urine output 40 milliliters per hour. B. Lactate increasing. C. Blood pressure falling. D. Increasing confusion. Correct answer: A. Urine output 40 milliliters per hour. Rationale: adequate urine output suggests improved organ perfusion. Strategy: good urine output is a positive sign in shock patients. Question 45. A patient receiving total parenteral nutrition suddenly becomes short of breath. What complication should the nurse suspect? A. Air embolism. B. Cataracts. C. Migraine. D. Fracture. Correct answer: A. Air embolism. Rationale: air entering a central venous catheter can cause sudden respiratory distress. Strategy: central line complications often appear on Nclex critical care questions. Question 46. A patient with gastrointestinal bleeding has a hemoglobin level of 6.5 g/dl. What intervention is anticipated? A. Blood transfusion. B. Fluid restriction. C. Ambulation. D. High-fiber diet. Correct answer: A. Blood transfusion. Rationale: severe anemia from blood loss often requires transfusion to restore oxygen carrying capacity. Strategy: extremely low hemoglobin levels usually require urgent treatment. Question 47. A patient with a pulmonary embolism suddenly develops cyanosis. What should the nurse do first? A. Increase oxygen delivery. B. Encourage exercise. C. Restrict fluids. D. Lower the head of bed. Correct answer: A. Increase oxygen delivery. Rationale: cyanosis indicates severe hypoxemia requiring immediate intervention. Strategy: airway and oxygenation always take priority. Question 48. A patient with severe hyperglycemia develops deep, rapid respirations. What type of breathing pattern is this? A. Cheyne-Stokes respirations. B. Kussmaul respirations. C. Apneustic breathing. D. Biot respirations. Correct answer: B. Kussmaul respirations. Rationale: Kussmaul respirations occur as the body attempts to compensate for metabolic acidosis. Strategy: DKA and Kussmaul respirations are commonly tested together. Question 49. A patient with heart failure has gained 3 kilograms, 6 pounds, in 2 days. What does this most likely indicate? A. Fluid retention. B. Improved status. C. Dehydration. D. Malnutrition. Correct answer: A. Fluid retention. Rationale: rapid weight gain in heart failure usually reflects fluid accumulation. Strategy: daily weight is one of the most reliable indicators of fluid status. Question 50. A patient recovering from septic shock has warm skin, adequate urine output, and a blood pressure of 118/76 mmHg. Which conclusion is appropriate? A. Shock is worsening. B. Tissue perfusion is improving. C. Respiratory failure is developing. D. Kidney failure is progressing. Correct answer, B. Tissue perfusion is improving. Rationale: normal blood pressure, adequate urine output, and warm skin suggest improved circulation and organ perfusion. Strategy: look for evidence that organs are receiving adequate blood flow when evaluating recovery from shock.